It's a rudimentary rehabilitation centre.
2 minutes down, 4 left to go. Well done.
A corridor in Addenbrooke's hospital is being used to assess Maria, who had COVID-19 back in March.
How hard did you find that?
So sick with the virus, the 55-year-old had to be ventilated for 2 weeks.
When I wake up once in the ICU, I told the ICU nurse that I'm already dead.
She told me she thought she'd died. She hadn't, but back here today for the first time, she's seeing doctors about the ongoing effects.
When you do something with stress, with the time, I feel really, shortness of breath I had, and still until now.
This is the clinic that the patients come to. It's called a carousel clinic. They start by seeing the physio, they see an intensive care consultant, a respiratory consultant, the pharmacist, all here to help monitor their long-term recovery, which is likely to take many, many months.
Hello. Hi.
Hi.
Dan came off a ventilator in April. He's still suffering from chronic tiredness and muscle weakness. I asked the doctor who set up the clinic what concerns her most about the patients.
For a lot of diseases that we have to deal with, we can give a patient a reasonably realistic view of what the long term may hold. This group of patients, it's much, much harder, and it feels like there are many more uncertainties. I think that's the bit I'm struggling with the most.
As a medical practitioner, do you find that very hard, not being able to tell someone?
I mean, we deal with uncertainty all the time, but I can't even give an average or what we think normal looks like or expected looks like with this particular group, and that is really difficult.
Despite Dr. Bernstein's honesty about the complexity of COVID, Dan is optimistic about his own recovery.
Still got the pains, still got the aches, and just a tiredness.
Do you foresee a time where that might go, where you might be able to get on with your life, perhaps go back to work?
Hopefully, yes. Not sure how long it will take, but fingers crossed it will be sooner than later.
We realise that this has actually hit you quite hard from a psychological perspective as well.
Other patients end up with damaged vocal cords.
We saw a gentleman in his 70s on Monday, and he is also presenting with a kind of voice problem simply because of how worn out and fatigued his respiratory muscles are, so he can't power his voice.
I joined a speech therapy session with Karen, who's suffering the same. She came off a ventilator 4 months ago and still can't speak properly, but is struggling more with her mental health.
Ever since I've been out of hospital, one of the big things for me is the feeling of survivor's guilt, I think is the best way to put it. Every time I see a news programme and hear the figures of how many people have died, it's very hard not to think, why did I survive? What's so special about me? And all those poor people haven't survived.
Every hospital up and down the country is having to find ways to support these patients. They're in new territory here and learning all the time. Emily Morgan, News at 10 in Cambridge.